Hello, and welcome to the Standpoint. Well, very soon we'll get to the Christmas season, and you know that I love Christmas. But hey, we are not going to wait till 2020 is here before we prepare our minds, our souls, our body, and you know I'm a health freak. So today we are going to talk about a part of the body makeup that we normally ignore. We just assume that it works by itself. The brain. Remember in September, we did a program about Jennifer Folsom. And we talked about brain aneurysm. Like me, most of you didn't even know that there was something like that. The doctor, whose name we kept mentioning, Dr. Sarkodie, is here in the studio today, and he's going to educate us on brain aneurysm. And if you are nice to me, if you are very nice to me, maybe, just maybe, you get to meet Jennifer too. Well, my name is Ahinere Giftianti. Welcome to the Standpoint. Today, it's about education, it's about empowerment, it's about enlightenment, it's about making sure that we enter 2020. I know a few weeks more, but we enter 2020 with a renewed mind to make sure that we take very good care. There are certain things we can't control, but then you make sure that health check, you don't mess with it. Welcome back to the Standpoint. If you just joined us today, I have Dr. Sarkodie in the studio. We are going to talk about brain aneurysm in detail. You remember somewhere in March, this year, 2019, there was a BBC focus on Ghana where they talked about a breakthrough brain surgery performed right here in Ghana, the first ever, maybe in Africa or in the world. We'll find out, or later. But then Daily Graphic also followed up with a story about a brain surgery performed here in Ghana without cutting through the scalp, but going through wherever, I don't know. But a brain surgery was performed, and, it put Ghana out there, but typical Ghanaians, we didn't celebrate much, we didn't follow up, and so there are many people out there who don't know about that. The man behind it is here. We are going to talk to him about it. But first of all, let me acknowledge my audience. They are from Mount Olivet Methodist Youth Fellowship, Kasua. Please put your hands together for yourself. And I hear your slogan is "We One." Thank you very much. I also have with me my daughter, Dr. Emma Klein. Now, I don't know where she's specializing. Every time she tells me. Now, what are you? Pediatrics? Department of Pediatrics. Yeah, that's the beginning. You haven't specialized yet. Okay, good to see you. And I'll introduce somebody later, but I won't tell you now. Let me come to the studio and my set. And my guest today is Dr. Benjamin Dabo Sarkodie. He is a consultant, interventional radiologist, lecturer, University of Ghana Medical School. Please put your hands together for him. My father, I remember those days when he was sick at the General Hospital and on his bed. Every time I went to visit him, he would tell me, Nana, some small boy doctor be or or small girl or baby doctor. That's he used to. Doc, you don't look like a doctor. You look too young to do all these things. Tell me about you. Who are you?
That's a very difficult question. Thank you. So my name is Benjamin Dabo Sarkodie. As you said, I'm pretty old, even though I look young.
Baby face. Okay.
Yeah, so I'm a radiologist and now an interventional radiologist. Interventional radiology basically means that you are treating certain disease conditions through a small incision under image guidance. So there are three things there. You are treating a condition.
Okay.
You are going through a very small incision, which we call minimally invasive surgery.
Okay, speak English.
And then
small incision is like a small hole.
Pinhole. Like a half centimeter incision.
Okay.
And then you are doing all of this under the guidance of like an X-ray machine or a CT scan. So these three things combined helps us or gives us the opportunity to treat a host of conditions in the body from the head to the toe.
Okay, where did you grow up?
I grew up in a small town called Ketekrachi, and then went on to Bishop Herman College. Then came to Kwame Nkrumah University of Science and Technology. Subsequently to the Kolebu Teaching Hospital, and then to University of Pennsylvania Hospital in the U.S. Back and then to Singapore General Hospital, and then to South Korea. So I've been around the world studying.
Are your parents still alive?
My dad died 10 years ago at the age of 80 years, but my mom is still alive.
Your mom is still alive. Does she follow up to see what you're doing now?
Oh, yes, and I get calls from her on a daily basis.
How does she feel?
Well, she's quite happy, and she's proud of me knowing where I have come from, and she's always praying for me.
Tell me, how was growing up like for you?
It was quite a happy moment for me. I was loved, my family. Interesting thing is that I didn't get to see my father early enough, but then the family stood in for me, uncles, aunties, my mom, until there was a reunion again and everything went on well.
So you say that you were one of those raised by the community?
Yes.
Raised by the community.
My grandmother, to be specific, was the one who actually took care of me till I was about 12.
Okay. Now, growing up, did you dream about becoming a medical professional, a doctor, or specializing in becoming, a well-celebrated kind of specialist?
It was always a dream for me. And the turning point actually was when I visited my uncle in the village, and he had a diabetic foot ulcer. And once I saw him, I ran out of the room. So I went to ask my mom what was the problem, and she said she didn't know. But everybody in the village said he had done something against the gods, and so the gods were out after him, and they needed to do all sort of pacifications, which didn't help him. But then later in school, then I realized that this man had all the symptoms were so clear that he had a diabetic foot ulcer, and we could have given him an extended life just by doing a surgery on him. So that really pushed me, and I was like, no, I have to become a doctor, and I have to save more people like my uncle.
And especially you have to become a surgeon.
Yes, at the point I didn't even know the differences. I just thought that I would be a doctor and I will save lives.
Save lives. So bottom line, to save lives.
Yes.
Now, at what point did you decide to specialize in this brain kind of condition?
Yeah. Okay, so again, even when I started medical school, I didn't even know what interventional radiology was. Yeah. But then in fifth year, I had a chance to go to the Thomas Jefferson Hospital in Philadelphia. And even then, I had gone to do urology. Then I saw these guys now putting in some catheters, some wires into people. So I asked them, what is this? And they said, oh, this is interventional radiology. So I said to myself, I want to do this. I want to become an interventional radiologist. And there's nobody in Ghana with that kind of expertise. But then I said, okay, what's the pathway to becoming an interventional radiologist? So you first have to become a radiologist and then subspecialize after radiology. So I'm happy that I was able to push that through.
So you're one of those you refer to as very adventurous.
Yes, I am.
And very daring.
Yes.
Risk-taking.
Yes. I am like a maverick.
and Maverick is a crazy one.
Yeah.
Yours is crazy attached to the Maverick
in a positive way.
In a positive way.
Yes.
Well, what's your feeling like anytime you have to go to the theater to perform a surgery?
It is one of an excitement and at the same time one of a reflection, because I'm excited because, oh, this can be done. But at the same time, I also know that I need to plan. I think that I spend more time planning my surgeries sometimes than even the procedure itself. So I'm playing all the scenarios in my head. What am I going to do? If A doesn't work, what do I do? If B doesn't work, what do I do? At least I must have A, B, C plans on the table before I go in. So it is a moment that I'm happy about, but at the same time, one that makes me a bit nervy, because I want to make sure that I have all my plans.
So for you, it's not like going in there to do try and error.
No. You cannot do trial and error, but you go there, you face challenges, and sometimes at that point, you have to rethink. There are times you have to think on your feet, because things are not going the way you expected them to go.
Right.
And those are a bit difficult moments.
Okay.
But we always remain calm, knowing that we'll find the light at the end of the tunnel.
Is there a God factor in all this?
Yes, I believe in God, and I have believed in God for a long time. And most of the things I do, I will pray. Like before I prayed on Jennifer, I was in the prayer room, right in the theater. There's a small corner where I go and hide and say a prayer.
So it's like your war room.
Exactly.
You pray for God to
pray
take
and ask God to take over, to guide us, and take us to that expected destination.
Do you have a family of your own?
Yes, I do.
Married? With
I am married with 3 kids.
With 3
2
kids.
boys, 10, RJ, Ryan, and Limi. The last one is a girl, Limi.
And the girl, and her name
she's
is
6 years, Limi.
Limi, 6 years. Do they know who you are and what you do?
They know I'm a doctor, and sometimes they tell me, oh, they saw some of my surgeries and all of that, but I don't think they are yet able to appreciate like what I do.
What about your wife?
Yes, my wife is very supportive. She's been there for me. I've been married 11 years now. And in between, I've had to go to school and, you know, traveling around almost all the continents in the world, trying to get knowledge. And I am one person, one of the things that hurts me most is to hear that a patient has a condition. We say, oh, we can't do this in Ghana. We can't do this. You have to go somewhere. So sometimes I have to tell my wife, I say, you know what? For the past 3 years, all my leave period, I've gone outside the country to go and acquire more knowledge.
Wow.
So I go to another hospital, spend 1 month, see how things are being done there. What can I add to the skill I already have?
At your own expense?
Yes, at my own cost. And so that is what I do. And my wife has been very supportive through all of that. There are times I will leave the kids with her. In fact, during the birth of my first 2 kids, I wasn't even there because I was in school. You know, so she is one worth celebrating.
What's her name?
Mamiti wa Sarkodie.
Madam Mamiti wa Sarkodie, I salute you. Thank you so much. You know, normally the Bible says that he who finds a good wife, you know, finds a good thing and obtains a favor. And a good wife, definitely you are. And the blessed woman is the one who is celebrated publicly by her husband. So we salute you. You know, me, I will have to find me a way of roping in the woman thing. You know what I mean? Well, we take a break. When we come back, we'll get into brain aneurysm. But now we know who is behind this surgery, who Dr. Sarkodie is, who is this man who, you know, has put Ghana on the medical world once again. Now to the studio and to Dr. Benjamin Dabo Sarkodie. Now you mentioned that before you got to hear about this interventional radiology, there was nothing like that in Ghana. BBC reported when you performed the first brain surgery here in Ghana. Graphic did same. Now, what was that experience like for you?
Thank you. It was a difficult one, and I say so because there was a lady, 66-year-old, who had collapsed, and it was discovered that she had a brain aneurysm. We had not even done one in Ghana at the time.
Not a single one,
Not
the whole
a
of
single
Ghana.
one. In fact, the whole of West Africa. And so what happened is that there was a doctor, a neurointerventional radiologist from Hungary who was contacted. And they also contacted me, and I was like, well, we are planning to do this, but we haven't done it yet. So this woman's condition is dire. We need to do something or she will not survive. We were not ready because we were still in the process. But fortunately, we had acquired the software that we need on our machine to be able to do this procedure. So the doctor colleague flew from Hungary, came here, and we did the first case together. And from that time up to now...
The woman survived?
Yes, she survived and she is doing well. And from that time up to now, we've done close to 10 cases. You know, so that is how it started. We knew that if we didn't do this, it was going to be a problem because most people had to fly out. And it's not everybody who even had the luxury of time, because the
Did you have-
condition
yeah,
may
did
not
you-
even allow you to fly.
Did you have people doubting whether you can be done here?
Oh,
Which
yes.
was the first.
Yes. Even subsequently, people doubted us until they saw the results, which is a good thing. I mean, people have the right to think that maybe because this has not been done, it cannot be done. You know, but then we had to prove them wrong. And that is exactly what we have done.
Because prior to that, everything, we have Auntie Doris, who is at the back there. She's a survivor. If I can get the camera to get here, Auntie Doris, if you can stand for me. Yeah, she was on the program in September when we discussed Jennifer's, condition. And she's had to be flown to India, right? India for that surgery.
Yeah.
And when we started appealing for Jennifer, people made comment, oh, you should try India. That's the best. They can do it for a fraction of the cost and everything. But Auntie Doris, when you said in India, how much did it cost you?
Well, I took $25,000 to India for the treatment, the treatment and then accommodation, everything. It was about $25,000. But I'm told...
Minus your ticket.
Yeah. Minus my ticket. But I'm told other places it costs about $90,000.
Other places?
Yes, in the US. In the US, my Dr. Victor Smatabi said it was around $90,000.
Wow.
Yes.
Wow.
Very expensive.
It's very expensive. Yeah. So, I mean, there were people who were saying you can do it and all sorts of things. So there was that doubt.
Yes.
People didn't know, but typical, normally they
Yes.
don't tell their stories, But Jennifer's condition. Now, we had a Dr. Agbemafle, who was on the program and said that Jennifer's aneurysm was one of the biggest that you had seen in the country.
Indeed, for those, we have two kinds of aneurysm. So at the stage where the aneurysm has not ruptured, you don't typically even get symptoms. And then there's another stage where the aneurysm has leaked or has ruptured, and those ones give us symptoms. So for those ones that have leaked, Jennifer's own was the biggest that we had seen. But there are bigger ones that we have seen which have still not ruptured. So it's like a time bomb. Nobody knows when it's going to rupture. And
let's get deep into this aneurysm and what it's about. What causes it?
the cause of an aneurysm we do not understand properly. But what we do know is that people are normally born with it. So once you are born, there's a small point of weakness within the artery. And as you grow up, and sometimes some environmental factors like having smoking, high blood pressure, and a host of other things, they go and add up to this problem that you were born with. And together, it makes it grow. And as it grows, it can compress on nearby structures, it can compress on nerves and start giving you symptoms. Sometimes gives you headaches, vomiting, dizziness, and all kinds of complaints. However, when it gets to a certain tipping point, it ruptures. And often you get a small leak, which will give you some headache that you've never had in your life. And at that point, if it's not treated, then the bigger rupture will follow after some time. Again, nobody can tell when that happens.
Okay. You talked about certain factors that can, push it to maybe develop and grow. Some people have said that sometimes, abuse, hitting of the head and people falling. Is that possible?
We don't have a scientific evidence to that, but we know that alcohol, smoking, hypertension, female gender, because of all my patients, the 10, only one has been a male. The ones that we've treated so far in this country.
So it's predominantly
only one
in women?
It's predominantly a women's condition.
Oh, Lord, why us? Wow.
Yeah.
Wow. So how did you get to hear about Jennifer's case?
I'm trying to even remember because I've seen so many cases in the last few months.
Okay, hold on. Seen so many cases?
Yes, so many cases.
Does that mean it's
the
common?
10 are people that have been able to afford treatment. As I speak to you, yesterday, I had 2 patients who are ruptured. One of them, another 26-year-old lady who was just preparing to go to nursing school. Another one, 22 years old, referred to me all the way from Sierra Leone. And so it's a big issue.
Wow.
It's a big issue. So at least from that period up to now, we've seen about 20 people with this condition. At least 20 people.
And I'm told most of the time it's doctors don't, our doctors don't normally diagnose it rightly. Sometimes you'll be treated for the headache and there won't be any further probe into whether it is aneurysm.
The problem is that, like we said, for the longest time, we were not doing treatment here. So the awareness amongst our doctors and even among the populace is very low. And so now, through this program, through education of doctors, through education of the public, we are creating that awareness for people to know that this condition is here with us. Indeed, Professor Yim wrote a paper somewhere in the 80s and said that he's a pathologist and he looked at people at the mortuary and found that 6% of all the bodies he was examining had aneurysms here in Ghana. 6%. No, so it's a big issue. It's just because some time ago we didn't have the treatment here and we were not having a high index of suspicion. But now we know, and we know that we can treat this condition. And you see, typically, 20% of people who rupture their aneurysms, they die before they reach the hospital. So you just hear, oh, I have a headache, I have this bad headache. So, okay, let's take him or her to the hospital. By the time they get to hospital, the person is dead. So nobody even knows what kills him. And everybody says, oh, he was healthy, she was healthy. We saw her yesterday, we were in church, we were singing together. Before Jennifer, there was another young lady who was singing in church, collapsed right in church, 26-year-old. And it was because she had leaked from an aneurysm in the brain. So it is a very common condition. But the good news is that at least we can do something about it now. If we see it early and we treat it, we can save a life.
Let me take another break. When we come back, we'll continue the discussion because it is common. 20% die before they get to the hospital. Now, Dr. Sarkodie, we didn't talk about how you met Jennifer or how you heard about Jennifer's case.
So one morning I had a phone. These treatments are costly. And so I think the company, this was a Euracare.
Euracare,
So she had a letter to state the cost of the procedure and all of that. And they did mention that the financial implications were great and beyond their reach. And so I did advise them that they should talk to Doris, who is a brain aneurysm survivor who has a foundation. And I think subsequently, Doris also contacted you.
Ladies and gentlemen, Jennifer is with us in the studio today, smiling. How are you?
Please, I'm fine.
Very fine.
Yes, please.
How did you feel after the surgery?
Actually, I was asleep, but when I woke up, I was in my room.
When you woke up, you were in your room.
So I didn't see actually what went on. But after which, I was kind of feeling dizzy, and I was feeling sleepy as well. But the next day, I was
how did you feel emotionally, knowing that now you're okay? Did you even believe it, that it's done, that you're going to be okay, that you're fine?
It was seriously weird. Like, I don't know whether I was fine or not. I was feeling different. But the headache in which I was feeling, I realized that it wasn't there anymore. I was fine. But just I was feeling weak.
Okay.
Yeah.
Now, prior to that, when you were on the hospital bed, when we had to run around seeking for support for you, and so on and so forth, were you scared?
Yes, I was. Because, like he said, it was the biggest they've ever seen, so I was scared. And my guy was making it look weird. He said, I'm not supposed to hear whatever that is going on because at least mistake, I'll be gone. So they kept things from me. I wasn't hearing what was going on. Though they didn't want to tell me what was going on, but inside me, I was scared. But until Sister Doris came and told me about what she went through, and I was like, then I don't need to be scared anymore. So the day she came, I even told her that thanks for coming because you've encouraged me. I was really scared inside. Yeah, but when she came, she showed me her video, told me stuff. Even the first time she came, the word she told me is that you're not going to die. You don't need to think about anything. That word alone encouraged me. So thanks to Sister Doris for giving me that motivation.
But somehow, behind there, in your brain, in your mind, you were still scared that you were going to die. Did you think we were going to be able to raise that money?
It was my first time, and even around the world or something like that, them contributing. So I was like, I don't think they'll get that money. So I was surprised when I heard that they did. And even with you and everyone that contributed, I was amazed. I was really, really amazed that they could able to raise. And, you know, I didn't grow up here. I kind of grew up in Nigeria. So I don't really know the amount of the money. But every time I keep hearing about them, I was like, wow, then Ghanaians are really helping. And then Nigeria too were helping as well because I have families there. And they also did their rally and all of that. And then Christine too did that for me. And God bless Christine very, very much for me. She has always been there. And then I had people too from India too also contributed.
I see.
Yeah.
Yeah, I see. So what have you got to say to all these people?
First of all, to say thank you to God for letting everything go through successfully because I didn't believe I would be alive today. I really had massive headache. I felt like removing my head off. To the extent I had to cut my hair. So if I'm here, it's all by the grace of God. And I want to thank everyone that prayed, that supported me, that was there with me. Especially my friend. She was always there for me. She bathed me and all that. And then to you, Mommy, thank you so much. When they told me you were coming, I was like, no way. No way. And when I saw you, I was so happy inside. Thank you very much. God bless you.
God bless you.
And I can't mention everybody's name, but thank you so much. Especially my father too, my spiritual father, Apostle Bernard Afrisa Taylor, and his wife, Mama Naomi Afrisa Taylor. God bless you.
They have really done well.
And to my baby's father, God bless you also for always being there for me. God really bless you. Alfredo Utuanta.
How has this changed your life? Do you think your life is going to be the same after going through all this?
No, it's not. I've been through hell and I'm back, but in everything, I just want to thank God for everything. Thank you very much.
Thank you too. And I would like to, applaud your pastor and his wife because I think they've done very well, especially in these days where everything is spiritualized. And I hear they actually pushed for you to go to the hospital.
The very day I fell down, I went to their house.
You went to their house, yes. But they insisted and made sure you went to the hospital, and then they were involved. Other people would say they were casting out demons and not even allow her because she's very close to them. So I was really pleased and very, excited that a prophet, a pastor, young as well, got involved in this. And he was very passionate. Is he back? No. He's still not back, okay. He's wherever it is, but we'll still send WhatsApp messages every time. And we are grateful. And Doc, thank you so much for your patience and also getting involved in Jennifer's case because I don't think you should have been here.
Well, I think the thanks goes to you, actually, because whenever people need to raise that quantum of money and they don't have it, I know that right from when they started the social media campaign for fundraising, something was coming in. But the moment you added your voice to it, it was astronomical jump. Less than a week, we had that money. By the way, I have good news for you. It is just the start. We need you to be an ambassador for this.
Yeah, we just thank God for the opportunity, for the platform, for the voice, and it's for the good. It's not for our personal,
Yeah.
you never know
Absolutely.
what will happen. But, Doc, what is that on the table?
So
It looks like a
this is a platinum coil. So this is
platinum
what
coil.
Yes, it's a coil made of platinum. Okay, it's flexible, thin. You can feel it.
Yeah.
Yes. It's
Yeah.
like a thread, but it's
Yeah.
made of platinum.
Wow.
So that weakness, that area where the bleeding happens, these are the kind of things we put in there to stop the bleeding. And by the way, one of these costs more than $1,000.
Wow.
You need to push in a lot of this into that aneurysm. You could put in about 10, you could put in about 5. The number varies according to the size of that aneurysm. And in addition, you use a lot of other things to finish this procedure. So one of my friends was asking me, Doc, so why don't you people do these surgeries for free? And I said, oh, yes, what we are doing is almost for free. But these ones, we don't produce them here,
Yeah.
and nobody's going to give you this for free.
Free.
And so most of the cost actually goes into procuring these
Yeah.
items for the surgery.
Yeah. Yeah. Because when I came to Euracare, the lady in charge, what's the name?
Maria.
Maria was saying, Gifty, when I saw the thing, I was like, really? This thing costs $1,000, but then it saves a life. And really, healthcare is maybe expensive in Ghana, but then elsewhere, as Doris said, it costs much more
yes.
if we can get the government support and everything. But then the good thing is that there are still good people in Ghana, people
Yes.
with a heart who can support. So, I mean, we pray it doesn't happen to anybody, but you never know when you will need help.
Yes.
But I still don't get it. How you are going to the brain and then you cut what? The navel area?
So actually, it's somewhere here
Lower.
in the groin.
Lower.
Here,
Even
in the
lower.
groin.
Around the groin.
Yes. So there is an artery
Yeah.
here, somewhere in the thigh. So it's
Okay.
just around this spot.
Okay.
And so what we do is we enter that artery, and then we track the catheters all the way up onto the brain.
And how do you work in the brain with that, whatever that goes in there?
Yeah, so, like I mentioned earlier, we have machines,
Yeah.
and so we are watching
Okay.
and guiding the catheters onto the exact place where we want them
Okay,
to
so
go.
you push these things through the arteries
all
and
the
way
way up
to.
there. Yes.
Wow. And people still think there's no God. And it's God who has just to give this kind of wisdom, who has to give this kind of wisdom for it to be done. But the good news is now we are doing it here in Ghana.
Yeah.
Typical of Ghanaians, and our governments, and our politicians, and our leaders. They will not get hold of this. They will not be involved in it. And then we will have people from other countries coming in to seek the help, to seek the support, to seek the treatment. And our people, God forbid, may be dying. But what I'm happy is that, Doc, now you have started a trend. And I believe that younger people out there, those aspiring to go into medicine, will also try or would dare to follow your footsteps, because you can't do this alone.
Yes, absolutely. We need more people to come into this space. And January next year, I'm starting a fellowship training for another person in this area. So we are hoping that in a few years, we can get more people in this space.
Thank you. God bless you.